afternoon. How great was that Simone Biles in Rio? Dominated the games. 5 medals, 4 golds. Now this morning she's answering questions about her health after her medical records were leaked. And they did show she had permission to use this medication she was using for ADHD during the competition. But some people are now asking if those drugs gave her an unfair leg up at the Olympics.
And there it is.
This morning, America's golden girl targeted.
She's just got so much power.
Simone Biles, one of the victims of the latest cyber attack. Hackers circulating confidential medical records belonging to some of Team USA's star athletes. The leaked documents reveal 19-year-old Biles tested positive for methylphenidate, a typical stimulant for treating ADHD. The International Gymnastics Federation approved her use of the medication. Biles later tweeted, "I have ADHD. I've taken medicine for it since I was a kid. Please know I believe in clean sport, have always followed the rules." ADHD, or attention deficit hyperactivity disorder, is a condition usually diagnosed during childhood, but it often lasts well into adulthood. Common symptoms include trouble concentrating, being overly active. And one other decorated Olympian has grappled with ADHD, Michael Phelps, diagnosed at age 9. But Simone Biles is refusing to let the breach throw her off balance. Here's her tweet. "Having ADHD and taking medicine for it is nothing to be ashamed of." Let's talk about this now with Dr. Jen Ashton coming in again today. Of course, it is nothing at all to be ashamed of. We hear all the time about some kids, especially going into college, even if they haven't been diagnosed with ADHD, they're taking the medicine. Does it help them?
Well, look, you're talking about a class of medication known as stimulants. Amphetamine is one of them. These have been out for over 50 years. Their profile, both in terms of safety, efficacy, and their side effects or risks, is very well known. Yes, it's a very common drug of abuse, especially in college kids. And it really, the data shows it probably works differently. You know, when you give it to someone with ADHD, it really helps that focus and concentration via transmitters in the brain. If you give it to someone who doesn't have ADHD, there's probably a big placebo effect. We talk about that all the time. And the data, most of it shows it really doesn't help you.
What kind of a difference could it make to a gymnast?
Well, look, if you take a look at this graphic, George, these are the common side effects that you can see with this medication. The things like increased heart rate, shortness of breath, no appetite or weight loss. No athlete would want any of these things. So again, I think it's really important to understand here that while it's a banned substance, if you have a therapeutic use and doctor's documentation, there's nothing illegal medically
And she had all the documentation, but now that it has been revealed, now that she's speaking out about it, that could help people.
I think it has to help people. This is something that affects about 5, some people say 10% of the population. There is no shame in the ADHD game. It's 2016. If you had high blood pressure, you would treat it. And I think the more we talk about this as just a medical condition, the less stigma it has to have, because a lot of people suffering with this feel embarrassment and they do feel shame, and that has to stop.
I'm sure this is going to generate a lot of questions. It'll be on Twitter all morning. Thanks very much.